Hi, everyone. Welcome to another episode of Sisters in Scrubs. I'm Dr. Rebecca, a family doctor.
And I'm Dr. Vanessa, your pharmacist.
And today we're going to talk about something that we get asked often at the clinic. It's what kind of supplements we should actually be taking on a daily basis. And I know you guys get a lot of conflicting information on social media, and sometimes it is really hard to know what's worth taking, where should we put our money, is it going to help us achieve our goals,
And where should we draw the line?
Exactly. And today we're going to cut through all of that and give you evidence-based information. So up first, we're going to talk about creatine. And I know a lot of you guys are going to think of this big bulky guy at the gym who needs creatine to build muscle. But let me tell you something, it's beneficial for just about everybody in their 30s, and we're going to explain to you why. So creatine is actually made from amino acids, and we can find small amounts of it in meat and in fish. So our body makes creatine as well. But as of our mid-30s, our levels start to decline slowly.
So creatine is actually very beneficial if you pair it with a proper strength training routine. Studies do show that creatine paired with strength training is going to be more beneficial to increase muscle mass than just strength training alone. What we do know is that as of the age of 30, we're losing about 1% of muscle mass every year. So creatine helps slow all of that down.
So now we're going to talk about two actually very recent studies about creatine and its benefits. So there's a 2025 review on creatine, and there were older adults using this, and the benefits that we saw were on lean muscle mass, muscle strength, bone density, functional ability, and cognitive performance as well. And there was another meta-analysis of 16 trials that found that creatine improved memory and processing speed as well.
So what I do understand from all of this is that creatine is not only beneficial for muscle mass, now we know that clearly the evidence shows that it is beneficial for cognitive health. From a pharmacy standpoint, I really love creatine because of its safety profile. Creatine, specifically creatine monohydrate, is the most studied supplement. We have decades of data, and it is shown to be safe and effective for people with healthy kidneys. Now, one thing that I want people to actually remember is that creatine is going to pull water into your muscle cells. So it is normal for the first couple of weeks to see the scale go up by maybe 1 or 2 kilos, but it is not fat gain, it is water. And usually after a couple of weeks, it does subside. So like we said, creatine monohydrate is the most studied form. So that's normally what we would recommend our patients to take, anywhere between 3 to 5 grams daily, so once a day. No need to do any loading phases. It might take a couple of weeks for you to actually see a difference. I would say anywhere between 4 to 8 weeks. You might start to see subtle differences in the beginning in terms of strength when you're exercising, or just in terms of sleep or cognitive health as well. But it might take a little bit longer for you to actually see the full benefits. And the most important thing with creatine is consistency. It has to be taken every day.
So the second supplement we're going to talk about is vitamin D. But calling it a vitamin is actually misleading because vitamin D is actually a hormone.
It's a steroid hormone.
Yes. And vitamin D is actually produced by sunlight, and vitamin D receptors are all over our bodies, bones, brain, immune cells. So when you run low on vitamin D, like most of us in Canada and some people in the States, we're running low on not only bone health, but immune health, heart health.
One thing to remember is that most people, especially in North America, are vitamin D deficient. So make sure to get your levels checked to know where you're actually standing. If you are taking vitamin D supplementation, make sure you're taking it with vitamin K2, because vitamin D is going to increase calcium absorption. However, K2 is going to ensure that the calcium is going in the bones and not the arteries. If you're going to take vitamin K, again, make sure to check with your pharmacist, your doctor. A quick disclaimer, if you are taking any blood thinner medication, vitamin K can interact with those medications. So again, always make sure to consult a healthcare provider such as your pharmacist or your doctor so that we make sure that this is okay with whatever you're taking.
So to sum up, make sure you get your vitamin D levels tested first, and then start on supplements. Most people in North America need around 1,000 to 2,000 units a day. According to your results, sometimes you might need more, so your doctor or pharmacist can suggest for you to take more. And like we said, pair it with K2 if necessary or if it's okay with you. According to studies, you can actually take it with fatty foods because vitamin D is fat soluble, so it's absorbed a little bit better. So the third supplement we're going to talk about is magnesium, but not just any magnesium. We're going to talk about magnesium glycinate. So magnesium runs low in our diet, but it is a cofactor in over 600 enzymatic reactions, so it has a lot of functions in our body. Here's how I explain it to patients. Magnesium is our body's natural off switch. When we're running low, we get more anxious, our muscles are tighter, and we sleep less well.
Another thing to consider, and the reason why we're emphasizing on magnesium glycinate, is because there are a lot of forms of magnesium out there, such as magnesium oxide. However, magnesium glycinate is the one that has the highest bioavailability. So the one that's going to be the better absorbed by your body. It also has a calming effect because it binds to glycine. So it really does help, like Dr. Rebecca said, for sleep, for muscle recovery, and also for anxiety. So you want to take ideally about 300 to 400 milligrams of magnesium glycinate every night. I would say an hour before bed. Make sure to always check elemental magnesium because that's really the amount of magnesium that we want, those 300 to 400 milligrams of elemental magnesium. It might take a couple of weeks for you to actually see a difference. You should, however, see a difference for most people, I would say, in about 2 to 4 weeks. When it comes to sleep.
So number 4 on our list is omega-3 fish oils. So this is where it gets a little bit complicated because back in the day, we used to say, take fish oil, take omega-3, and protect your heart. But then some big trials came up where people were taking the standard low dose, so 1 gram a day. And with people who had a low cardiovascular risk and that were eating a healthy diet, taking omega-3 fish oil wasn't doing much. So then it became complicated to say, okay, who can take it? Who should take it?
So with more recent evidence, there are more clear recommendations for whom omega-3 might be beneficial. So number one, for people who have high triglycerides, so evidence shows that it does help decrease triglyceride levels. Number two, if you already have heart disease or a high cardiovascular risk. And number three is if you have depression or mood disorders, there are some studies that show that EPA might be beneficial.
So now let's talk about studies about omega-3 and the evidence. So there are evidence that shows that it can reduce cardiovascular mortality by 7% and non-fatal heart attacks by 13%. The benefit is actually stronger at higher dosages, so 2 to 4 grams a day, and in higher risk populations, like we said. For triglycerides, 15 to 30% reduction at therapeutic doses, so like we said, probably 2 to 4 grams a day, and this is actually FDA approved. And for depression, it was mainly beneficial for people who were taking the ones that were EPA dominant. So now let's talk about brain health. DHA is actually the main fat component of your brain cells. So your neurons are actually made of it. You want to make sure that you're not running low, especially as you get older.
So as a practical guide, what I tell my patients is if you're not having a fatty fish source at least twice a week, such as salmon, sardines, mackerel, then supplementation might be necessary for you. If you are, then you might not need supplements. But let's be real, most people are not meeting the recommendations. So very important, if you are taking omega-3 supplements, to have something that is high quality. We want anywhere between 1 to 2 grams of EPA and DHA combined fish oil, not just fish oil. We really want specifically EPA and DHA. If you have heart disease and you're taking anything over 1 gram a day, make sure to speak to your doctor prior. Number 5 is protein. So it's not a supplement in the traditional sense, but it's to make sure that you're having enough of. So essentially, most people are under eating on protein. According to the new guidelines and recommendations, and according to the newest evidence that we have, we want anywhere between 1.6 to 2 grams per kilo of protein a day. So for someone that is weighing about 70 kilos, that means that we want somewhere between 110 to 140 grams of protein a day, whereas most people are probably having anywhere between 60 to 70 grams of protein a day. So that's pretty low. And what we do know, as we've discussed before, is that with age, we do lose muscle mass. So for people who are not eating enough protein, then there's an increased risk of sarcopenia. Sarcopenia is age-related muscle loss. So that's where protein kind of comes in, paired with obviously a proper strength training program.
So we can't talk about protein without talking about collagen. Now, collagen is everywhere. A lot of people are adding it in their diet, in their smoothies, without actually knowing why and what it does. So collagen is actually a protein. It's actually 30% of the protein that's contained in our bodies. However, unlike the protein that we eat or whey protein, it's not going to act on our muscle, but everything around it. So the cartilage, the ligaments, the tendons, and even our skin. So, adding collagen peptides with whey protein, for example, can be beneficial to increase muscle mass and also protect everything around it. So, collagen is usually for people who are dealing with joint pain or who train regularly.
So, as we mentioned before, you want anywhere between 1.6 to 2 grams per kilo of protein a day. Ideally, we want that spread across 3 to 4 meals as opposed to having it in one big meal. If you're struggling to achieve your protein targets just with whole foods, you can always aim for whey protein to help increase protein intake. Joints and connective tissue, you want ideally 15 grams of hydrolyzed collagen peptides once a day, and ideally paired with vitamin C to increase absorption. You can always take it 30 minutes before an exercise session. So, to sum all of this up, number one, creatine monohydrate. So, you really want creatine monohydrate specifically. You want anywhere between 3 to 5 grams a day. Number two, we talked about vitamin D. So we want to check your levels first and foremost to see where we're at, and make sure to speak with a healthcare provider before incorporating vitamin K2 to make sure that it's compatible with your health condition and whatever you're taking. But for most people, most healthy people, between 1,000 to 2,000 units a day of vitamin D is beneficial.
So, number three is magnesium, not just any magnesium, magnesium glycinate, and 300 to 400 milligrams a day. Number four is omega-3 fish oils. Aim for EPA and DHA 1 to 2 grams a day. Obviously, talk to your doctor if it's accurate and if it's okay for you. And last but not least, we talked about protein. So 1.6 to 2 grams per kilogram of your weight, plus collagen peptides, 15 grams a day.
So, as we said before, these are just a few supplements, a few key supplements that ensure that you're getting everything that you need, but it will not replace a healthy lifestyle, a healthy diet, an exercise routine, a good sleep routine. These are just add ons. And all of the supplements that we mentioned are science backed information. These are even things that we are personally taking, so we wouldn't just recommend things to you without trying it ourselves. But always make sure to speak with a healthcare provider to ensure that all of these supplements are compatible with your health conditions and with whatever medication you're taking.
So, thank you for listening and stay tuned for more.